So I have nothing to disclose. Sorry for that. So few studies have described the voiding pattern of healthy, continent, and or asymptomatic women. And the women included in these studies had a measurable detrusor contraction and variable participation of abdominal muscles. So that could be considered the normal voiding pattern. But the definition of what was considered a detrusor contraction vary between the studies. So the aims of our study was to describe the voiding pattern in women without voiding symptoms and to compare some clinical and urodynamics characteristics between women that urinate with the detrusor contraction from that women that urinate without the detrusor contraction. So this was a 3-period retrospective study where the information was registered at the time of urodynamics and patients with voiding symptoms were excluded. Slow stream, straining to void, and intermittent stream. And we did further exclusions to make the population quite more normal. So we had a study group of 186 women without voiding symptoms. We defined the detrusor contraction as the increase of the detrusor pressure at maximum flow of 10 or more centimeters of water over baseline, and abdominal contraction as the increase of abdominal pressure at maximum flow of the same amount over baseline. So we described 4 voiding patterns and made comparisons between women with and without the detrusor contraction voiding. Those were the statistics that we used. So we had 186 women with an average age of 58 years old, and the vast majority of them voided using the detrusor contraction with or without abdominal contraction. About 9% of them voided only using abdominal contraction, and 14% didn't use the detrusor contraction nor abdominal contraction. Looking at the numerical variables, we found that women that use the detrusor contraction during voiding were significantly younger than the others, but there wasn't any difference in Qmax nor in post-void residual volume. We studied these categorical variables being 50 years old or less, history of previous hysterectomy, the symptoms of urinary incontinence, the presence of the detrusor overactivity, and the presence of urodynamic stress urinary incontinence with high abdominal leak point pressures of over 100 or more centimeters of water, which was present in 75% of our patients. So if we look at the univariate analysis of the variables associated with voiding using the detrusor contraction, we can find that the age of 50 years or less was significantly associated, the presence of the detrusor overactivity, and the presence of urodynamic stress urinary incontinence with abdominal leak point pressures of 100 or over centimeters of water. But when we go to the multivariate analysis, only the age and the high pressure urodynamic stress urinary incontinence maintained their significances with odds ratio of 8.5 and 2.9 respectively. So in conclusion, we can say that the vast majority of women without voiding symptoms urinate using the detrusor contraction with or without abdominal contraction, with our definitions, and that the voiding pattern may vary with aging and changes in the degree of sphincteric deficiency. Thank you very much for your attention.
Thank you. The paper is now open for discussion. I haven't seen too many studies on normal women like this, that you've distinguished that around 25% of them don't seem to use much of a detrusor contraction to void. I haven't seen a large normal study on flow patterns. We've had the nomograms, of course, but in terms of flow patterns.
Yes.
Have you seen
Well,
other work
yes.
that like yourself?
Well, there are very few studies on that with few patients with different definitions of the true contraction, varying from 5 to 15 centimeters of water above the baseline.
Yeah.
And with the definition of abdominal contraction in any part of the micturition using the value of more than 10 centimeters of water. All of them showed that the 100% voided with the true contraction and between 0 to 70% voided using abdominal contraction with that definition in any part of the voiding. We focus here only at Qmax.
And how did you get your volunteers?
No, they are not volunteers. They are quite normal. They are patients with stress urinary incontinence, mixed urinary incontinence.
But no voiding symptoms?
No voiding symptoms and no any symptoms or history of previous problems in the lower urinary tract.
Are you intending to do a follow-up study on women with voiding symptoms to compare them?
Well, that's a good idea.
Yeah.
I think I'm going to do that.
Are there any questions that anyone has? Thank you very much for your presentation.